You're sitting in an exam room, you're in a paper gown. Doctor walks in, he glances at a screen and says the exact words you were dreading, which are, great news, your labs are all completely normal, but you don't feel normal. You feel absolutely terrible. You know your body, you know there's something wrong. And let me tell you right now, you're not crazy. It's not your age. It's not anxiety. I'm an RN for 20 years, and most of my experience is in the ER, psychiatric wards, and crisis leadership. Today, I'm giving you the clinical correction on why the medical system is failing your physical reality and exactly how to take your power back. Here's the secret of the modern medical system. It's built entirely on quantitative data. It worships numbers on a metabolic panel and a CBC. Why? Well, because 15-minute appointments were not designed to heal you. They were designed to rule out liability. But as a patient, you're experiencing qualitative data. So you're experiencing profound fatigue, phantom pain, brain fog, and a nervous system that feels like it's going to vibrate you right out of your skin. When your doctor says you're fine because the spreadsheet says so, that is systemic medical gaslighting. They're completely dismissing the somatic reality of what your body's actually holding. What blood work can't measure is trauma. The lab machine cannot quantify grief. Many of you watching have gone through what I call an identity amputation. Hear me out. A profound, devastating loss or a shift in who you are and how you exist in this world. I experienced my own at the intersection of being 9 months pregnant and losing my mom. And when you go through an identity amputation, your nervous system actually registers it as a physical injury. Your body absorbs the shock. You develop somatic symptoms because your tissues are keeping the score, even when your blood cells look perfectly normal under a microscope. Trying to force this complex, full-body grief to an outdated 1969 psychological model is setting you up to fail.
So what do you do at your next appointment? Well, first you're going to stop apologizing for your symptoms, and then you're going to use clinical language to force a clinical response. Matter of fact, write this down. The next time a doctor dismisses you with normal labs, I want you to look them right in the eye and say this. Hey doc, listen, I understand that my lab work is within normal limits. However, my daily function is severely impaired. My physical baseline has drastically shifted. What differential diagnosis are we considering for somatic symptoms? And please document in my chart that you're discharging me without a treatment plan for my pain. Watch how fast that dynamic changes when you refuse to be dismissed. You need to be the architect of your own healing. And that's going to always start with you validating your own somatic experiences. The very first step in my SOLO protocol, it's a clinical correction to how we actually process and survive found loss of medical gaslighting. Listen, if this resonated with you, I want to hear from you. I want you to tell me what exactly has been the most dismissive thing that a medical